An anonymous donation of $25 million has sparked an ambitious strategy to address the housing crisis in London, Ontario. More than 200 people died on the streets of London in the past 3 years. In response, the mayor has laid out a plan to put in place 24/7 solutions. He's here in Ottawa lobbying for more federal support for his plan and what he calls a permanent and sustainable system to help people experiencing homelessness. The Mayor of London, Josh Morgan, joins me now. Mayor Morgan, thanks for coming in.
Yeah, great to be here.
So this whole plan was kickstarted with an anonymous $25 million donation. I mean, how did that money show up? Any idea where it came from?
I know exactly where it came from because I know the donor. I'm just not allowed. I'm just not allowed to say. But I'll tell you, this is a family who did very well in their life, and they've seen the struggle of homelessness on the streets of London. And they said, you know, we've been philanthropists before. We've donated to many causes, but we need to do something so significant that it shifts the foundation of the discussion that's even happening on homelessness in London. And so this has really been the foundation of the work that we're doing and really creates that catalyst for us to actually have the opportunity to make some meaningful change in our city.
Okay, so $25 million is a lot of money, but homelessness is an enormous challenge. So how is this money going to be used and how does it fit into the big picture of what you're trying to do in London?
So first off, let me tell you the plan that we've developed and how it was developed. We had over 200 individuals come together representing over 70 different organizations. And when I say organizations, I mean not just people from our hospital systems or frontline workers who have been doing caring for people on the streets for decades, but also development community, business community, our police services, land ambulance services, everybody who you could think would come together to try to say, this is not working. How do we rebuild the system from the ground up? They did 3 amazing summits, and out the other end came a hub and homelessness system. So we've got hubs and housing. The hubs are low barrier, 24/7 spaces where people can access the services they need when they need them. But that all flows into supportive housing, so housing with wraparound service supports. And what we've realized is we have about 2,000 individuals on the streets in the City of London. 600 of those are high needs individuals who need critical supports. So we need about 5 hubs to start.
Okay,
and about
so
100
I just want to stop you there. Explain to me what a hub exactly is. I mean, we know of like shelters, for example. Is it a shelter? Is it smaller than that? A decentralized shelter system? What do you mean when you say a hub?
So each hub would service about 25 to 35 individuals. And so it would be a place where you can come in, you can get rest, you can get a shower, you can get some food. But it's also a place where you can start to access the services you might need. There's primary healthcare services there. There are addiction counseling services. There's employment services. There's housing services. So it's really a gateway into another journey in your life, the next step when you're ready to take it there. But it is all supported by supportive housing at the other end, because you can't have people come into a low barrier space, say, I'm ready to take the next step, access the services there and say, unfortunately, come back in a month, we've got nowhere to put you. So the housing piece is really critical to the success of the hub system.
So how do you have the housing at the other end of it for the 2,000 people? You say that there are 600 of them at acute risk. $25 million, does that help cover that much of a housing need? I mean, where are you on that?
Yeah, so it doesn't. So what this requires is just like it was a whole of community approach to develop the plan, it needs to be a whole of government approach to fund it. So we talked about that generous individual donation from that family, and we're now actively fundraising in the community to raise more money. But we're also reorganizing the money that we have at the municipal level under this banner, as well as our existing housing and homelessness programs can come under this, and we can shift resources that we already have. We're also working with the province and federal governments as well to align some of the programs that they have under this banner. So for example, just this week, Minister Clark, the Minister of Municipal Affairs and Housing in Ontario, was in London to announce an additional $8 million for the city, which is about a 60% increase in homelessness funding. That money also will go in part to the hub-based system. And so, you know, we've got city money, we've got private money, we've got provincial money, we've got access to federal programs to do the housing supportive side of things, and we're really trying to do a lot of advocacy to say that is going to get us so far, but to ultimately solve this program and problem, it's going to be a significant investment.
Right, and so you're here in Ottawa and you're having meetings, I guess, to get some of that significant investment. That's why people come to this town quite often. So who are you meeting with and what's your pitch?
Yeah, so far we've met with a number of ministers, Minister of Health, Minister Duclos, Minister Hussein on housing, Minister LeBlanc, Intergovernmental Affairs. I met with the Prime Minister in London when he was down for an announcement one-on-one for a little bit. we're talking to them about the housing side of things. Because if you think about the supportive housing piece, there's healthcare dollars that would really be involved in the operational piece.
Right.
But on the capital side, we need money to actually refurbish and build the hubs and the supportive housing. And so that's where the federal government has been helpful in the past with their programs and can be helpful to support this type of initiative.
So a little bit more on the hubs. I mean, it helps you decentralize, I guess, and fan out the entry points into the system for people, right? Because if you have one big centralized shelter, it could be remote, hard to get to. Is that the general idea, having more points of contact to get more at-risk people, making a positive connection and an entry point into the system?
That's exactly it, but it's also each hub might have different focuses. So you can think about the needs of, say, people our age who might have a mental health challenge and are seeking some supports would walk into a hub. You might not have that same hub be accessed by single moms who are living on the street who have kids. Our Indigenous community is alongside of the work we're doing, designing their supports for a hub-based system that can integrate into our model. But the other thing about the hub system is it's a one-number access. So there is one referral point, everything gets referred into the hub system, and everything branches out from there. That is where all of these services that were spread across the city, provided by dozens and dozens of different agencies, converge into a point of access and a referral point for getting everything you could possibly need to help yourself go to that next stage in your life.
Right, so it also lets you, having hubs as opposed to one big center, it lets you specialize and fine-tune the services that are offered there. So, I mean, how quickly will all of these be up and running? When are you going to have the hub system going at full speed?
So as we're speaking today, there's a governance and implementation group that is meeting in the city. It involves those partners, those hundreds of individuals and agencies. So this month we will know the governance model and the implementation model, and then we will ramp up implementation tables. Our expectation is that we need to have the initial hubs in place by the fall.
Right.
So that's that first batch of hubs. So we'll have a summer where we'll have to manage the situation as best we can, and we've got tons of supportive partners to do that. But ultimately this year, we're trying to ramp up, 5 hubs, 100 supportive housing spaces, but down the road, we're going to need 12 to 15 hubs and 600 supportive housing spaces.
So what do you think the homelessness picture will look like then in London if this model is successful in its implementation and its adoption? I mean, where do you hope this is in 2 years, 3 years, 4 years?
There's going to be less people dying and more people permanently housed. We had 6 people die associated with housing, or homelessness, lack of housing, I should say, this week in the City of London. 6 people lost their lives for a variety of reasons. And we're seeing not just people die from exposure or accidents like fires, but people are now entering the emergency room with things like trench foot, like wartime, like injuries that you just haven't seen because the conditions out there just aren't humane. And so, I said in my State of the City speech, our delay is not measured in days, it's ultimately measured in deaths. And we have to act as quick as we possibly can because 6 people lost their lives on London streets just in the past week, and that's not something that is sustainable. It's not something that we should accept, and it's something that we absolutely have to change.
Josh Morgan, Mayor of London, Ontario, thank you for your time.
Thank you.